All right, so let's jump into this deep dive that we've designed to help you just ace your pharmaceutical biotechnology exam.
Definitely.
We are going to be looking at your BSc Biotechnology Semester VI notes.
Yes.
And specifically focus on like a really crucial area, antibiotics.
For sure.
Now, I know you guys are already familiar with the basics, but we're going a little bit beyond that.
Yes.
We're not just memorizing names and structures.
Right.
We're going like deep
Absolutely.
into the mechanisms, the why behind their classification, and how all this knowledge translates into real-world treatment strategies.
Yeah, think of this deep dive as your secret weapon.
Yeah.
That's really going to help you not just pass the exam, but understand the nuances of antibiotic selection, their applications, and the challenges we face, like antibiotic resistance.
Okay, so let's just jump right into it.
Yeah.
We're going to start with kind of the big guns here, the beta-lactam antibiotics.
Okay.
Why are these so important in the world of antimicrobial drugs?
Beta-lactams, they are a cornerstone of antibiotic therapy. They all share that characteristic beta-lactam ring.
Right.
But the real key is their mechanism of action.
Okay.
They target bacterial cell walls, specifically by inhibiting the enzymes responsible for building and maintaining those walls.
Okay.
So this leads to weakening instability, and eventually the cell bursts open lysis, and the bacteria is destroyed.
So they're like the demolition experts taking down those bacterial walls.
Yes, exactly.
And within the beta-lactam family, we've got penicillins, cephalosporins, carbapenems, and monobactams.
Right.
It's like a whole squad of wall busters.
Yes.
Let's start with penicillins.
Okay.
Those are the classic ones.
Yeah. Penicillins, like the classic penicillin G, they have a special place in history.
Yeah.
You know, they were among the first discovered and are still effective against many gram-positive infections, especially things like pneumonia caused by streptococcus metabolism.
Resistance.
By targeting those peptidation enzymes that are crucial for cross-linking the peptidoglycan layers in the bacterial cell wall. No cross-links, no strong wall, and boom, the bacteria is done for.
That's pretty straightforward. And I see here that amoxicillin is another important penicillin.
Yes.
How does it differ from penicillin G?
Amoxicillin has a broader spectrum of activity. It can tackle a wider range of bacteria compared to penicillin G.
Okay.
That's why it's often the go-to choice for things like respiratory tract infections, urinary tract infections, and ear infections.
Ah, so it's like the multi-purpose tool of the penicillin family.
Yes, exactly.
But I noticed it's often combined with clavulanic acid. Why is that?
That's where the battle against antibiotic resistance comes in.
Okay.
Some bacteria have evolved to produce beta-lactamases, enzymes that can break down that beta-lactam ring, making our penicillin useless. Clavulanic acid acts as a beta-lactamase inhibitor.
Okay.
It's like sending in a shield to protect amoxicillin so it can do its job.
It's a two-pronged attack.
Exactly.
And speaking of production, how are penicillins actually made?
We harness the power of nature here. Penicillins are produced through fermentation using penicillium fungi.
Wow.
These fungi are grown in large bioreactors under very specific conditions to churn out those life-saving medications.
Amazing how we can just use these natural processes to create such powerful drugs.
Absolutely.
Okay, so we've got penicillins covered. What about cephalosporins?
Right.
How do they fit into this beta-lactam picture?
Cephalosporins, they're like the evolved cousins of penicillins.
Okay.
They also have that beta-lactam ring, but it's fused to a slightly different structure.
Okay.
Now, here's where it gets really interesting. Cephalosporins are grouped into generations.
Okay.
And each generation shows an evolution in terms of its effectiveness against resistant bacteria.
So they're like leveling up with each generation.
Exactly.
What are some examples of these different generations and what are they used for?
So think of it this way.
Okay.
You've got the first generation, like cefazolin, which is primarily used for surgical prophylaxis. It targets mainly gram-positive bacteria. Then we move to third-generation cephalosporins, like ceftriaxone, which is a powerhouse against serious infections like meningitis.
Wow.
And then there are the fourth-generation cephalosporins, like cefepime, which can tackle even more resistant strains.
It's fascinating how scientists have been able to develop these increasingly powerful antibiotics.
Absolutely.
But I imagine there are still challenges, even with these later generations.
Absolutely. One of the biggest hurdles is the rise of extended spectrum beta-lactamoses.
Okay.
Those ESBLs we mentioned earlier,
Right.
these enzymes produced by certain bacteria can break down many of our cephalosporins, making them ineffective.
It's like a constant arms race between the bacteria and our antibiotics.
It is.
By the way, how are cephalosporins produced? Is it similar to penicillin?
You're catching on.
Okay.
Cephalosporins are also produced through fermentation,
Hmm.
but this time it's the Acremonium chrysogenum fungus
Okay.
doing the work in those carefully controlled bioreactors.
So we've got fungi making penicillins and a different fungus making cephalosporins.
That's right.
Nature's pretty incredible. Now let's talk about the heavy hitters.
Yeah.
The carbapenems. They sound pretty intense.
Carbapenems are like the special forces of the beta-lactam world.
Okay.
They have a modified beta-lactam structure, giving them extra resilience against those pesky beta-lactamuses.
Right.
They're often our last line of defense against multi-drug-resistant organisms.
So when other antibiotics fail, we bring in the carbapenems.
Exactly.
What are some examples and how are they used?
One example is meropenem.
Okay.
It's a broad-spectrum antibiotic often used for severe infections, especially those caused by multi-drug-resistant organisms.
Right.
Then there's imipenem, which is often paired with cilistatin.
I see that combination in my notes, imipenem with cilistatin. Why the combo?
It's all about protecting the kidneys.
Yeah.
Imipenem on its own can be broken down in the kidneys, reducing its effectiveness.
Right.
Cilistatin acts as a shield, preventing that breakdown and allowing imipenem to reach its target and fight those infections.
It's like giving imipenem a bodyguard to ensure it gets to the battlefield.
Exactly.
But even with these heavy hitters, there are still challenges.
Right? You bet the emergence of carbapenemeses, enzymes that can break down even carbapenems, is a serious threat.
Wow.
This type of resistance is especially worrisome because carbapenems are often our last resort.
That is scary. It sounds like we're always playing catch-up with these resistant bacteria.
It is a challenge.
By the way, how are carbapenems produced in other fungus?
Not this time.
Okay.
While carbapenems are also made using fermentation, often starting with Streptomyces bacteria,
Okay.
there's an extra step.
Okay.
After fermentation, they go through chemical modifications to create that final, powerful drug structure.
So it's a combination of nature's power and some clever chemistry.
Exactly.
Okay, we've tackled penicillins, cephalosporins, and carbapenems. Let's wrap up the beta-lactams with monobactams.
Okay.
What makes them unique?
Monobactams are the minimalist members of the beta-lactam family.
Yeah.
They have a single beta-lactam ring without the additional fused ring structure of the others.
Interesting. So they're like the streamlined version.
Yeah.
What's a key example and how is it used?
Aztreonam is the star here.
Okay.
It's effective against aerobic gram-negative bacteria.
Yeah.
What makes it particularly useful is that it can be used in patients who are allergic to penicillin.
Right.
And considering how common penicillin allergies are, that's a big deal.
That makes sense. It provides a valuable alternative. But what about resistance? Are they as vulnerable as other beta-lactams?
Monobactams are actually pretty good at dodging resistance because of their unique structure.
Okay.
They're not affected by many of the common beta-lactamuses. However, they are still vulnerable to some specific ones, so resistance is still a concern.
It seems like no antibiotic is entirely immune to resistance.
That's right.
And based on what we've seen so far, I'm guessing monobactams are also produced through fermentation.
You got it. Aztreonam is produced using, drumroll please, bacteria.
Right.
This time it's Chromobacterium violaceum doing the work in those bioreactors.
So we've got both fungi and bacteria contributing to these life-saving medications.
That's right.
That's pretty cool. Now, we spent quite a bit of time on beta-lactams, those cell wall attackers.
Yes.
What other antibiotic powerhouses should we explore?
Let's shift gears and talk about aminoglycosides.
Okay.
These antibiotics are known for their bactericidal action, meaning they directly kill bacteria, not just inhibit their growth.
Ooh, that sounds powerful. How do aminoglycosides work their magic?
They're like tiny saboteurs that sneak into the bacterial cell and disrupt protein synthesis.
Okay.
They do this by binding to the 30S ribosomal subunit,
Right.
which is a crucial part of the bacteria's protein-making machinery. This causes errors in how genetic information is read, leading to faulty proteins, and eventually the bacterial cell dies.
It's like throwing a wrench into their protein factory.
Yeah, sure.
And I see here that gencamicin is a key aminoglycoside. What's it typically used for?
Gentamicin is often used for serious infections caused by aerobic gram-negative bacilli, especially a particularly troublesome one called Pseudomonas aeruginosa.
Okay.
It can be a real challenge to treat, and gentamicin is one of our valuable weapons against it.
So it sounds like a real lifesaver. But as with any powerful medication, I imagine there are potential downsides. What are some side effects associated with aminoglycosides?
You're right to be cautious.
Okay.
While effective aminoglycosides do carry the risk of serious side effects.
Right.
Two of the major concerns are nephrotoxicity, meaning damage to the kidneys, and onotoxicity, which can lead to hearing loss.
Those are definitely some serious side effects.
Yes.
It highlights the importance of careful monitoring and using these medications wisely.
Absolutely.
Before we move on to the next class, what about production? Are we back to fermentation with aminoglycosides?
You're getting the hang of this, yes. Aminoglycosides are also produced through fermentation, primarily using various species of, you guessed it, Streptomyces bacteria.
Streptomyces is like the ultimate antibiotic factory.
They are.
Okay, so we've covered the cell wall attackers, the beta-lactams, and the protein synthesis disruptors.
Yes.
The aminoglycosides. What's next on our antibiotic adventure?
Let's dive into another class of protein synthesis inhibitors.
Okay.
The tetracyclines, they work a bit differently than aminoglycosides, but their ultimate goal is the same.
Okay.
To stop bacteria from making the proteins they need to survive.
Okay. I'm intrigued. How do tetracyclines go about shutting down protein synthesis?
Like aminoglycosides.
Okay.
Tetracyclines target the 30S ribosomal subunit, but instead of causing errors in genetic information reading, they directly block the attachment of aminoacyl tRNA to the ribosome.
Hold on, remind me, what's aminoacyl tRNA again?
It's the delivery truck that brings the building blocks of proteins, amino acids, to the ribosome where they're assembled.
Right.
Tetracyclines basically block the loading dock, preventing the delivery truck from dropping off its cargo. No amino acids, no protein synthesis.
So they're essentially cutting off the supply line that's clever.
Exactly.
And I see here that tetracyclines are known for their broad spectrum activity.
Yes.
What does that mean in practice?
It means they're effective against a wide range of bacterial pathogens. Both gram-positive and gram-negative. This makes them very versatile tools for treating various infections.
That versatility must be valuable in many clinical situations.
It is.
What are some specific examples of tetracyclines and their uses?
We have the classic tetracycline, which is still used for things like acne and some respiratory infections. Then there's doxycycline, which has become very popular because of its longer half-life. It stays in the body longer, meaning you can take it less frequently. Doxycycline is particularly useful for Lyme disease and as a preventative measure for malaria.
It's like the extended release version of tetracycline.
Exactly.
But I'm guessing like most medications, there are things to be cautious about with tetracyclines.
You're right to be cautious. One thing to be aware of is photosensitivity. They can make your skin more sensitive to sunlight. So sunscreen is a must if you're taking tetracyclines. Another caution is their potential effects on bone growth in children. They can bind to calcium in developing bones and teeth. Which can interfere with growth.
Those are definitely important considerations, and I'm anticipating your answer to this one. Are tetracyclines also produced through fermentation?
You're on a roll. Tetracyclines are indeed produced through fermentation, and you guessed it, our trusty Streptomyces bacteria are at it again.
Those bacteria really are the antibiotic superstars.
They are.
Okay, so we've covered beta-lactams, aminoglycosides, and tetracyclines. What other protein synthesis inhibitors do we need to know?
Let's talk about macrolides. They're another group that targets bacterial protein synthesis, but with a unique twist.
All right, I'm ready for that twist.
Yeah.
How do macrolides differ from aminoglycosides and tetracyclines?
Instead of binding to the 30S ribosomal subunit, macrolides go for the 50S subunit. And rather than preventing amino acid attachment or causing errors in reading genetic code, they block the exit tunnel of the ribosome.
The exit tunnel? What's that all about?
Imagine the ribosome as a tiny factory where proteins are assembled. The exit tunnel is like the door where those newly made proteins leave the factory. Macrolides basically block this door, preventing the proteins from getting out and doing their job. No protein export, no bacterial growth.
I love that visual.
Yeah.
They're essentially trapping those proteins inside the factory.
That's right.
What are some examples of macrolides and their uses?
Erythromycin is a classic macrolide, often used for respiratory infections and as an alternative for patients allergic to penicillin. Then we have azithromycin, better known as Zithromax. which is famous for its long half-life.
Yeah.
You might only need to take it for a short period sometimes, even just a single dose.
Wow.
Azithromycin is commonly used for things like pneumonia and some sexually transmitted infections.
So it's like the convenient option for those who don't like taking pills every day.
Exactly.
But I'm sure, like with all antibiotics,
Yeah.
there are things to watch out for with macrolides, right?
Absolutely.
Okay.
While generally well tolerated, macrolides can cause some gastrointestinal issues like nausea and vomiting.
Yeah.
Erythromycin in particular can be tough on the stomach.
Right.
There's also a risk of liver toxicity, especially with higher doses or prolonged use.
Right.
And in some cases, they can even cause heart rhythm abnormalities.
Those are definitely serious potential side effects.
They are.
It's a good reminder that all medications, even those that are generally safe, can have downsides.
Yep.
And I'm going to guess are macrolides, also made by those incredible Streptomyces bacteria.
You got it. You've definitely noticed the pattern here.
I have.
Macrolides are indeed produced via fermentation using, Streptomyces bacteria.
It's amazing how these tiny organisms play such a huge role in producing so many of the antibiotics we rely on.
It is amazing.
All right, we've covered a lot of ground with the major antibiotic classes: beta-lactams, aminoglycosides, tetracyclines, and macrolides.
Yes.
Are there any other key players in the antibiotic world we should know about?
Think of them as the special forces of antibiotics. Classes with more specialized uses or unique mechanisms of action.
Okay.
They come into play in very specific situations where other antibiotics might not be effective.
Oh, I like that, special forces antibiotics.
Yeah.
What are some examples and what makes them so unique?
One of the most well-known is vancomycin, a glycopeptide antibiotic.
Okay.
It's often called upon when we need the big guns, especially for serious gram-positive infections caused by MRSA methicillin-resistant Staphylococcus aureus.
MRSA, that's a scary one. We hear about it all the time.
Yeah.
How does vancomycin work against such a tough opponent?
Vancomycin is another cell wall inhibitor, but it works differently than beta-lactams. It binds to specific precursors on those peptidoglycan strands that make up the bacterial cell wall, preventing them from being incorporated into the growing wall.
So it's a different target, but a similar end result: a weakened cell wall and a defeated bacteria.
Exactly.
But I imagine there are potential side effects.
Yeah.
Especially with a powerful antibiotic like vancomycin.
You're right to be cautious.
Okay.
Vancomycin can cause kidney damage. So careful monitoring of kidney function is essential.
Okay.
And then there's the infamous red man syndrome, a reaction that can happen during or after infusion.
Okay.
Think flushing and a red rash, especially on the face and upper body.
Wow, that sounds pretty dramatic. Okay, we've got vancomycin, the MRSA slayer.
Oh.
What other special forces antibiotics are in our arsenal?
Let's talk about sulfonamides.
Okay.
Specifically, trimethoprim sulfamethoxazole,
Okay.
often called cotrimoxazole for short.
Right.
This dynamic duo works synergistically.
Right.
They're more potent together than alone.
I love a good power couple in the antibiotic world. How did trimethoprim and sulfamethoxazole team up to fight bacteria?
They interfere with folate synthesis, which is crucial for bacterial growth.
Okay.
Folate is a B vitamin that bacteria need to make DNA, RNA, and other vital molecules.
Okay.
Trimethoprim and sulfamethoxazole block different steps in the folate synthesis pathway, essentially cutting off the bacteria's supply of this essential nutrient.
So they're starving the bacteria of what they need to survive.
Exactly.
What are some infections that cotrimoxazole is commonly used for?
It's a go-to for urinary tract infections and certain types of pneumonia, particularly those caused by Pneumocystis jirovecii, which is often seen in people with weakened immune systems.
Okay, that's good to know. But I imagine there are also some potential downsides to cotrimoxazole.
Good question.
What are some things to watch out for?
One concern is hypersensitivity reactions.
Okay.
Basically allergic reactions.
Yeah.
These can range from mild skin rashes to more serious systemic reactions. There's also a potential for problems with blood cell production.
Okay.
And even the formation of crystals in the urine.
Oh, wow.
If patients don't stay well hydrated.
Okay, definitely some things to be mindful of.
Yeah.
It's fascinating how each antibiotic has its own set of strengths and weaknesses.
Absolutely.
What other special forces antibiotics are on our list?
Let's move on to quinolones.
Okay.
Specifically fluoroquinolones. These antibiotics are known for their broad spectrum activity against both gram-negative and some gram-positive bacteria.
They're like the multi-talented members of the special forces. How do fluoroquinolones fight bacteria?
They target bacterial DNA replication by inhibiting two crucial enzymes, DNA gyrase and topoisomerase LV.
Okay.
These enzymes are essential for unwinding and separating DNA strands during replication.
Okay.
A process necessary for bacteria to multiply.
Right.
By blocking these enzymes, fluoroquinolones effectively stop bacterial replication in its tracks.
It's like jamming the copying machine.
Exactly.
What are some common fluoroquinolones and what are they used for?
Ciprofloxacin and levofloxacin are two well-known fluoroquinolones.
Okay.
They're often used for a wide range of infections, including respiratory tract infections, urinary tract infections, and skin infections.
Okay.
They're especially valuable for treating infections caused by resistant strains.
They sound like powerful tools for tackling those tough cases. But I imagine, as with most potent medications, there are potential downsides to fluoroquinolones as well.
You are absolutely right.
Okay.
Fluoroquinolones can cause some serious side effects.
Right.
One that's gotten a lot of attention is the risk of tendon rupture, especially in older adults or people taking corticosteroids.
Okay.
They can also cause problems with heart rhythm.
Okay.
And like many antibiotics, can lead to gastrointestinal issues.
Those are definitely things to consider carefully. It seems like the more powerful the antibiotic, the greater the potential for side effects.
That's often the case.
What other special forces antibiotics do we need to cover?
Let's talk about lincosamides.
Okay.
Clindamycin is the key player in this group.
Okay.
It's known for its effectiveness against anaerobic bacteria.
Okay.
And certain gram-positive cocci, like Staphylococcus aureus.
Anaerobic bacteria, those are the ones that thrive without oxygen, right?
Exactly.
Okay.
They're often found in deep wounds or abscesses. Clindamycin is a valuable tool for treating these types of infections as well as dental infections.
Right.
It's also a good alternative for patients allergic to penicillin.
So it fills a specific niche in the antibiotic world.
Yes, it does.
How does clindamycin work against these bacteria?
It's another protein synthesis inhibitor, working in a way similar to macrolides.
Okay.
It binds to the 50S ribosomal subunit and prevents peptide bonds from forming, effectively halting protein production.
It's another way of disrupting that bacterial protein factory.
That's right.
But I'm guessing there are potential side effects to watch out for with clindamycin as well?
You are right to be cautious. One of the biggest concerns with clindamycin is the risk of C. difficile infection. C. difficile is a bacterium that can cause severe diarrhea and inflammation of the colon.
That sounds pretty serious. Why does clindamycin increase the risk of this infection?
Clindamycin, like many antibiotics, can disrupt the balance of bacteria in the gut.
Okay.
This can allow C. difficile to take over and cause problems. It's really important to be aware of the symptoms of C. difficile infection.
Okay.
Things like watery diarrhea, abdominal pain, and fever.
Right.
And to seek medical attention right away if those symptoms appear.
Okay, that's important information. It really highlights the importance of using antibiotics carefully and being aware of potential complications.
Absolutely.
What's our final stop on this Special Forces antibiotic tour?
Let's finish with oxalidonones.
Okay.
Linezolid is the star player in this relatively new class of antibiotics.
Okay.
It's getting a lot of attention for its effectiveness against multi-drug-resistant gram-positive pathogens, including MRSA.
Another weapon against MRSA. It seems like we're always in need of new tools to fight these resistant bacteria. How does linezolid work against these tough opponents?
Linezolid is another protein synthesis inhibitor, but it works in a unique way. It binds to the 23S RNA of the 50S ribosomal subunit and prevents the formation of the initiation complex, which is essential for protein synthesis to even begin. Basically, it stops protein production before it can even get started.
That's a clever strategy. It seems like there are so many different ways to disrupt protein synthesis.
There are.
What are some typical uses for linezolid?
It's often used for treating pneumonia and skin infections caused by resistant strains, especially MRSA, because it's relatively new. It's often reserved for cases where other antibiotics have failed.
So it's a valuable option for those really challenging cases, but I'm sure there are potential downsides to linezolid as well.
You are spot on.
Okay. What are some things to keep in mind?
Linezolid can suppress bone marrow activity, leading to a decrease in red blood cells, white blood cells, and platelets. This can increase the risk of infections and bleeding problems. With long-term use, there's also a risk of nerve damage that can cause numbness, tingling, and pain in the hands and feet. And importantly, linezolid can interact with certain medications, such as antidepressants, potentially leading to a dangerous condition called serotonin syndrome.
Wow, those are serious potential side effects.
Yes.
It's a good reminder that even the newest antibiotics come with risks.
Absolutely.
Okay, we've covered a lot of ground with these specific antibiotic classes.
Yes.
From the heavy hitters to the specialized special forces.
Right.
Is there anything else we should discuss before we move on?
We've explored the individual classes, but now let's zoom out and discuss some broader concepts that apply to all antimicrobial drugs.
Okay.
These are fundamental principles that help us understand how to use these medications effectively and safely.
That sounds important. I'm ready to delve into these broader concepts. Where do we begin?
Let's start with spectrum of activity.
Okay.
This refers to the range of microorganisms an antibiotic can effectively target.
Okay.
Understanding this is crucial for choosing the right antibiotic for the job.
Right.
Kind of like selecting the right tool from a toolbox.
Yeah.
And minimizing the risk of resistance development.
Okay, I can see how that's important. We don't want to use a sledgehammer when a small hammer will do so. So how are antibiotics categorized based on their spectrum of activity?
We typically group them into three main categories.
Okay.
Narrow spectrum, broad spectrum, and extended spectrum antibiotics.
Okay, let's break those down. What are narrow spectrum antibiotics and what are their advantages?
Think of narrow spectrum antibiotics as specialists.
Okay.
They target a very specific subset of bacteria, often going after a unique pathway or structure that's only present in those bacteria. This precision is their strength.
So they're like laser-guided missiles homing in on their specific target.
Exactly.
Why is that precision a good thing?
It minimizes collateral damage.
Okay.
When you use a narrow spectrum antibiotic, you're only targeting the specific bacteria causing the infection, leaving the rest of the patient's healthy bacteria, their microbiome, relatively undisturbed. This helps prevent the development of antibiotic resistance and avoids disrupting the delicate balance of the microbiome, which can lead to other health issues.
That makes perfect sense.
Yeah.
It's like avoiding unnecessary bombing in a war.
Right.
We only want to hit the intended target. What are some examples of narrow-spectrum antibiotics that we've already talked about?
Penicillin G is a classic example. It's mainly effective against gram-positive cocci, like Streptococcus pneumonia, and some gram-negative bacteria, like Neisseria and meningitis. It's a narrow-spectrum antibiotic that's been used effectively for decades to treat specific infections.
Back to the origins of antibiotics. Okay, so narrow-spectrum antibiotics are the specialists. What about broad-spectrum antibiotics? When are they called upon?
Broad-spectrum antibiotics are like the generalists of the antibiotic world. They're effective against a wide variety of bacterial pathogens, including both gram-positive and gram-negative bacteria. They often work by inhibiting common bacterial processes like cell wall synthesis or protein synthesis, which are essential for the survival of many different types of bacteria.
So they're like the multi-tools of the antibiotic world. Why is this broad activity sometimes necessary?
There are a few scenarios where a broad-spectrum antibiotic might be the best choice. One is when we don't know the exact bacteria causing the infection if a patient has a serious infection, and we can't wait for lab tests to identify the culprit. A broad-spectrum antibiotic can be used to cover the most likely possibilities. Another scenario is when we're dealing with polymicrobial infections where multiple pathogens are involved. A broad-spectrum antibiotic can cover a wider range of potential offenders.
That makes sense. It's like casting a wide net to catch a variety of fish. What are some examples of broad-spectrum antibiotics that we've discussed?
Amoxicillin is a great example. It's effective against a wide range of bacteria and commonly used for respiratory infections, urinary tract infections, and ear infections. Another example is ciprofloxacin, a fluoroquinolone we talked about earlier. It's effective against many gram-negative and some gram-positive organisms, making it a valuable tool for treating various infections, including those caused by resistant strains.
They're like the Swiss Army knives of antibiotics, capable of tackling a variety of bacterial foes. Okay, we've got narrow spectrum and broad spectrum. What about extended spectrum antibiotics? Where do they fit in?
Extended spectrum antibiotics are like enhanced versions of existing antibiotics. They've been modified to target a wider range of bacteria, particularly those resistant strains that have evolved to evade our standard antibiotics.
So they're like the upgraded weapons in our ongoing battle against antibiotic resistance. How are they modified to achieve this extended reach?
They're designed to overcome specific resistance mechanisms that bacteria have developed. For example, some bacteria have evolved to produce enzymes that break down certain antibiotics. Extended spectrum antibiotics might have structural modifications that make them less susceptible to these enzymes, or they might have a broader range of targets within the bacteria, making it harder for resistance to develop.
It's like an arms race, constantly trying to stay one step ahead of the evolving bacteria. What are some examples of extended-spectrum antibiotics that we've encountered?
Ceftazidime is a good example. It's a third-generation cephalosporin with enhanced activity against Pseudomonas aeruginosa, a tough gram-negative bacterium that's known for its resistance to many antibiotics. Another example is piperacillin tazobactam, a combination that pairs a broad-spectrum penicillin with a beta-lactamase inhibitor, making it more effective against resistant organisms.
So they're like the special ops teams of the antibiotic world, equipped with the latest technology to combat those highly resistant foes. Okay, spectrum of activity. Check. What other important concepts should we cover?
Let's move on to pharmacokinetic properties. This refers to how the body handles an antibiotic from the moment it enters the body until it's eliminated. Understanding these properties is essential for determining the right dose frequency of administration and potential interactions with other medications.
That sounds crucial. We don't want the antibiotic hanging around for too long or disappearing too quickly. So how do we break down these pharmacokinetic properties?
We typically look at four main processes: absorption, distribution, metabolism, and excretion, often abbreviated as ADME.
Okay, let's start with absorption. What does that involve?
Absorption is how an antibiotic gets into the bloodstream after it's administered. It's basically the drug's journey from its entry point into the circulation so it can travel to its target.
So it's the first step in the antibiotic's adventure through the body. What factors influence how well an antibiotic is absorbed?
The route of administration is a big one. Intravenous administration, where the drug is injected directly into the bloodstream, means it's available immediately. Oral administration, on the other hand, can be influenced by a lot of factors like stomach acidity, food, and even the drug's formulation. Some antibiotics are better absorbed on an empty stomach, while others are best taken with food.
That makes sense. Different modes of transportation can affect how quickly a package is delivered. What about the antibiotic's chemical properties? Do those play a role in absorption?
Absolutely. The chemical properties, particularly how easily the drug dissolves in fats, which we call lipophilicity, greatly influences its ability to cross cell membranes. If a drug is very lipophilic, it can easily slip through the fatty layers of cell membranes, making it better absorbed.
So it's like having a VIP pass to get past those membrane checkpoints. Okay, absorption, check what happens next in the antibiotics journey.
Next up is distribution. This is how the antibiotic spreads throughout the body once it's in the bloodstream. Think of it as the delivery system that gets the antibiotic to the tissues and organs where it needs to fight the infection.
So it's like the Postal Service making sure the antibiotic package gets to the right address. What factors influence how an antibiotic is distributed throughout the body?
One key factor is the volume of distribution, often called VEED. This basically tells us how much a drug likes to hang out in body tissues compared to staying in the blood plasma. A high VEED means the drug is widely distributed throughout the body, while a low VEED means it mostly stays in the bloodstream.
So a high VEED is like a traveler who likes to explore, while a low VEED is a homebody. What else influences distribution?
Protein binding plays a big role. Many antibiotics like to bind to proteins in the blood, particularly albumin. But here's the catch. Only the unbound drug, the free drug, is pharmacologically active. It's the part that can actually interact with its target and do its job. If an antibiotic is highly protein-bound, a larger portion of it is stuck to proteins and less is available to fight the infection.
So protein binding is like having a chaperone that tags along but prevents the antibiotic from fully interacting with its target. That's interesting, and I can see how this could lead to drug interactions.
You're right. If two drugs bind to the same protein, they can compete for those binding sites. This can displace one of the drugs, increasing its free concentration in the blood and potentially lead into unexpected side effects or reduced effectiveness.
It's like a game of musical chairs. If one drug gets bumped off its protein, it's free to roam around and potentially cause trouble.
Okay.
So we've covered absorption and distribution. What's the next stop in our pharmacokinetic journey?
Next is metabolism. This is where the body modifies a drug, usually making it more water-soluble so it can be easily excreted. The liver is the main site for drug metabolism, and it uses a complex system of enzymes, particularly cytochrome P450 enzymes, to carry out these modifications.
So the liver is like the body's detox center, transforming the drug into a form that can be easily eliminated. Why is this transformation necessary?
Many drugs in their original form are too lipophilic. Remember, that means they prefer to dissolve in fats to be easily excreted by the kidneys. The liver's modifications make them more hydrophilic, meaning they prefer to dissolve in water. This makes it easier for the kidneys to filter them out and eliminate them in the urine.
So it's like changing the drug's outfit from a greasy jumpsuit to a water-friendly swimsuit so it can take a dip in the urinary pool. Okay, so metabolism, check. What about excretion? That's the final step of the process, right?
Exactly. Excretion is how the body gets rid of the drug, mainly through urine or feces. The kidneys are the key players here, filtering the blood and removing waste products, including those modified drugs and their metabolites.
So the kidneys are like the body's sanitation department, taking out the trash. What factors affect how efficiently a drug is excreted?
Kidney function is a major one. If the kidneys aren't working properly, drugs can build up in the body and cause toxicity. That's why it's so important to keep an eye on kidney function in patients taking antibiotics, especially those who already have kidney issues. Some antibiotics, like those aminoglycosides we talked about, can be particularly harmful to the kidneys.
That's a crucial point about personalized medicine, considering each patient's individual health status when choosing and dosing antibiotics. All right, we've covered the four main pharmacokinetic processes: absorption, distribution, metabolism, and excretion. What's the last key concept we need to tackle?
Let's talk about toxicity and side effects. Antibiotics are essential for fighting infections, but they can also have unwanted effects that range from mild to severe. Understanding these potential downsides is key for minimizing risks and making informed decisions about antibiotic use.
That's a good reminder that even life-saving medications can have a dark side. So how do we categorize the types of toxicity that antibiotics can cause?
We can broadly group them into two main categories: direct toxicity and allergic reactions.
Okay, let's start with direct toxicity. What does that mean exactly?
Direct toxicity happens when an antibiotic directly damages our own cells or tissues. This can occur if the antibiotic targets a pathway or structure that's similar in both bacteria and human cells, kind of like friendly fire.
So the antibiotic accidentally hits its own team. What are some examples of antibiotics that can cause this type of toxicity?
We've already touched on a few. Aminoglycosides, for example, can cause kidney damage because they build up in the kidney cells, harming those delicate structures and impairing kidney function. Tetracyclines, although generally safe, can interfere with bone growth and tooth development in children because they bind to calcium.
It's a good reminder to be aware of the potential downsides of even commonly used antibiotics. What about allergic reactions? How are those different from direct toxicity?
Allergic reactions are immune system responses to the antibiotic. They happen when the body misinterprets the antibiotic as a harmful invader and launches an immune attack against it.
So it's like the immune system having a misfire, overreacting to something that's not actually a threat. What are some common allergic reactions to antibiotics?
Penicillins are notorious for causing allergic reactions. They're among the most common drug allergens, and reactions can vary widely from mild skin rashes and itching to severe life-threatening anaphylaxis.
That sounds pretty serious. What happens during anaphylaxis?
Anaphylaxis is a very serious allergic reaction that can happen rapidly. It can involve a whole body response, including swelling difficulty, breathing, a drop in blood pressure, and even loss of consciousness. It's a medical emergency that requires immediate treatment.
It's definitely something to be aware of and take seriously. So
Yeah.
besides direct toxicity and allergic reactions, are there any other common side effects we should be aware of?
Yes. Gastrointestinal disturbances are very common with antibiotics. This often happens because antibiotics disrupt the normal balance of bacteria in the gut, leading to things like nausea, vomiting, and diarrhea. Remember how we talked about clindamycin and its association with C. difficile infection? That's a prime example of how disrupting the gut microbiome can lead to serious complications.
That's not something I'd want to experience. Are there any other common side effects we haven't discussed yet?
Some antibiotics can affect blood cell production, leading to a condition called blood dyscrasia. This can show up as a decrease in red blood cells, white blood cells, or platelets. A drop in red blood cells can lead to anemia, causing fatigue and weakness. A decrease in white blood cells can increase susceptibility to infections, and a decrease in platelets can cause problems with blood clotting and increase the risk of bleeding.
Wow, that's a whole cascade of potential problems, it seems like. Antibiotics, while essential, need to be used very carefully, and it's important to consider each patient's individual situation.
You are absolutely correct. Each antibiotic comes with its own unique profile of potential side effects and factors, like the patient's age, health history, other medications they are taking, and allergies all need to be carefully considered.
Okay, we've covered a lot of ground today. We've delved into specific antibiotic classes, their mechanisms and potential side effects, and we've also explored broader concepts like spectrum of activity and pharmacokinetic properties. I feel like I've gained a much deeper understanding of how these medications work and the complexities of using them safely and effectively.
It's been a great discussion. Understanding the nuances of antibiotics is essential for ensuring their appropriate use and for tackling the growing challenge of antibiotic resistance.
Speaking of resistance, I remember that being a big theme throughout our notes. Why is antibiotic resistance such a big deal, and what contributes to it?
Antibiotic resistance is one of the most pressing public health threats we face today. It's a natural phenomenon. Bacteria, like all living organisms, evolve to survive when we use antibiotics. We're essentially applying selective pressure that favors the survival and spread of resistant strains. The more we use antibiotics, especially if we use them inappropriately, the faster resistance develops.
So it's like we're inadvertently training the bacteria to become superbugs. What are some of the factors that contribute to this problem?
Overuse and misuse of antibiotics are major culprits. This includes prescribing antibiotics for viral infections which they can't treat, and using broad-spectrum antibiotics when narrow-spectrum ones would suffice. Another factor is the widespread use of antibiotics in agriculture, where they're often used to promote growth and prevent disease in livestock. This can lead to the development and spread of resistant bacteria that can then jump to humans.
It sounds like a complex problem with no easy solutions. What are some strategies that can help us combat this growing threat?
There are several approaches we can take. One is to promote responsible antibiotic use, both in healthcare settings and in agriculture. This includes educating healthcare providers and patients about the importance of appropriate antibiotic prescribing and use. Another strategy is to develop new antibiotics that can overcome existing resistance mechanisms. This is a challenging endeavor, but there are promising new approaches in the pipeline.
I remember from our notes that there's also a lot of research focus on developing alternative therapies to antibiotics. What are some of those alternatives?
There's a lot of excitement around phage therapy. Bacteriophages, or phages for short, are viruses that infect and kill bacteria. They're naturally found in the environment, and they've been used therapeutically in some parts of the world for decades. Another promising area is antimicrobial peptides, small proteins that have natural antimicrobial activity.
It sounds like scientists are exploring all sorts of creative approaches to combating bacterial infections. It's encouraging to know that there are potential alternatives to antibiotics on the horizon. Okay, before we wrap up, I wanted to revisit those fun facts sprinkled throughout our notes. I especially like the ones about how different antibiotics are produced.
Those production processes are pretty fascinating, aren't they? It's amazing how we can harness the power of nature, those tiny microorganisms, to produce these life-saving medications.
Exactly like the fact that penicillin, the OG antibiotic, is produced by those amazing penicillium fungi in giant bioreactors. It's like a science fiction movie.
It's a testament to the ingenuity of scientists who figured out how to mass produce these medications using those natural processes. And remember, it's not just fungi. Bacteria also play a major role.
Oh, right. The Streptomyces bacteria. They seem to be the MVPs of antibiotic production. They're responsible for producing a whole array of antibiotics like aminoglycosides, tetracyclines, and macrolides.
They're like tiny pharmaceutical factories. And let's not forget about those monobactums, the unique members of the beta-lactam family.
Ah, yes, Astrionem, the penicillin allergy savior. It's produced using a bacterium called Chromobacterium violaceum, right?
Exactly. It's fascinating how diverse the sources of these medications are.
It's like a reminder that nature holds a vast treasure trove of potential therapeutic agents just waiting to be discovered.
Well said. And speaking of harnessing nature's power, the production of carbapenems involves a really cool combination of fermentation and chemical modification. They often start with Streptomyces species, but then they go through some clever chemical tweaking to achieve their final potent structure.
It's like a collaboration between nature's brilliance and human ingenuity.
Exactly. It's a beautiful example of how we can work with nature to develop life-saving therapies.
Okay, before we wrap up this deep dive, I wanted to touch on something that really struck me as important throughout our discussion. We talked about all these different antibiotic classes, mechanisms, side effects, and considerations for choosing the right antibiotic.
Yeah.
It's a lot to take in, but one thing that stood out to me is the importance of personalized medicine when it comes to prescribing antibiotics.
It's not just about knowing the drug, it's about knowing the patient. Their individual characteristics, health history, and circumstances all play a role in choosing the best antibiotic and ensuring its safe and effective use.
Exactly. Factors like age, allergies, other medications, they might be taking kidney or liver function, even their lifestyle. All these things need to be considered to ensure that we're using the right antibiotic for that specific person.
Personalized medicine is becoming increasingly important in all areas of healthcare, and antibiotic prescribing is no exception. It's about moving away from a one-size-fits-all approach and tailoring treatment to the individual's unique needs.
It's about being thoughtful and precise in our approach to using these powerful medications. And it's not just the responsibility of healthcare professionals. Patients have a role to play too.
Absolutely. Patients can be active participants in their healthcare by asking questions, being informed about their medications, and taking antibiotics responsibly.
It's a partnership.
Okay.
Okay, we've covered a lot of ground in this deep dive, but I want to leave our listeners with a thought-provoking question to consider as they continue their studies. We've talked extensively about antibiotic resistance, its causes, and potential solutions. But thinking specifically about your upcoming exam, what are some key points you should focus on to demonstrate your understanding of this critical issue?
That's a great question. I would say it's important to be able to articulate a clear understanding of the mechanisms of antibiotic resistance. This includes how bacteria evolve to evade antibiotics, the different types of resistance mechanisms, and the factors that contribute to the spread of resistance.
So knowing the enemy, so to speak, what else is essential to understanding antibiotic resistance?
Being able to explain the consequences of antibiotic resistance is crucial. This includes the impact on individual patients' healthcare systems and global public health.
So understanding the big picture and the potential impact on a global scale, what about solutions? What are some key points to focus on when discussing strategies to combat resistance?
I would suggest highlighting the importance of responsible antibiotic use. This includes understanding the principles of appropriate prescribing, promoting patient education and awareness, and exploring strategies to reduce antibiotic use in agriculture.
So it's a multi-pronged approach involving education policy changes and even exploring alternative therapies.
Exactly. It's a complex problem that requires a multifaceted solution.
Okay, we've given you a lot to think about. We hope this deep dive has provided a solid foundation for your exam preparation and, more importantly, for your future careers in biotechnology.
It certainly has. Antibiotic resistance is a dynamic challenge, and staying up to date on the latest research and strategies is essential for anyone working in this field.
Absolutely. Okay, before we wrap things up completely, I want to make sure we haven't missed any important concepts that might pop up on your exam. We've talked about the different classes of antibiotics, their mechanism, spectrum of activity, pharmacokinetic properties, side effects, resistance. It's a lot to keep straight. What are some of the key takeaways that you as future biotechnologists should really solidify in your minds?
That's a great point. It's easy to get lost in the details. So let's zoom back out to the big picture. I think one of the most fundamental concepts is understanding the relationship between an antibiotic's mechanism of action and its spectrum of activity.
Okay, remind me, how are those two things connected?
An antibiotic's mechanism of action, how it actually kills or inhibits bacterial growth, directly influences which types of bacteria it will be effective against. For example, those beta-lactam antibiotics we talked about target bacterial cell wall synthesis. That mechanism means they're generally more effective against gram-positive bacteria, which have a thick peptidoglycan layer in their cell walls.
So knowing the mechanism helps us predict who the antibiotic's going to be effective against? That makes sense. What else is important to remember when it comes to mechanisms and spectrum of activity?
It's also important to understand how those mechanisms can relate to potential side effects. If an antibiotic targets a pathway that's similar in both bacteria and human cells, that raises the risk of toxicity. Think back to those aminoglycosides and their potential for kidney damage.
Right, targeting something that our own cells need can lead to unintended consequences. What other key takeaways should we highlight?
Another crucial concept is the interplay between pharmacokinetic properties and dosing. Remember how we talked about absorption, distribution, metabolism, and excretion? Those processes all influence how much drug gets to its target, how long it stays there, and how quickly it's eliminated from the body.
So it's not just about how much drug we give, it's about how the body handles that drug. What's a good example of how pharmacokinetic properties can influence dosing decisions?
Think back to doxycycline. It has a longer half-life than other tetracyclines, meaning it stays in the body longer. That's why it can be dosed less frequently, sometimes even just once a day, which can be really convenient for patients.
So understanding those pharmacokinetic properties helps us optimize dosing to maximize effectiveness and minimize side effects.
Yeah.
What else should we emphasize?
I can't overstate the importance of antibiotic resistance. Understanding the mechanisms of resistance, the factors that drive its development, and the strategies for combating it is absolutely crucial. This is a global challenge that requires a multi-pronged approach, and you, as future biotechnologists, have a critical role to play in tackling this issue.
It's a daunting challenge, but also an exciting opportunity to make a real difference.
I
think we've covered all the bases. We've reviewed the key classes of antibiotics, their mechanisms, spectrum of activity, pharmacokinetics, toxicity and resistance. We've even touched on those fascinating production processes and the importance of personalized medicine. I'm feeling much more confident about that exam.
Me too, remember. The key to success is not just memorizing facts, but understanding the concepts and how they connect. Think critically, ask questions, and don't be afraid to delve deeper into the areas that intrigue you.
That's great advice. And always remember, the world of antibiotics is constantly evolving. New drugs are being developed. Resistance patterns are changing. And our understanding of the complex interplay between antibiotics, bacteria, and our bodies is constantly growing.
That's what makes this field so dynamic and fascinating. Staying curious and informed is essential for navigating this ever-changing landscape.
Well said. We hope this deep dive has sparked your curiosity and provided you with the knowledge and tools you need to excel in your studies and beyond.
Thank you for joining us on this journey into the world of antibiotics. We wish you all the best in your exam and in your future careers as biotechnologists.